the record. We can always edit out the first minute or so. Okay. Okay, we're recording? Okay. Hey, folks, I think we're going to get started here. Thank you for showing up. This is the first Distinguished Dean's lecture for the year, and depending upon whether you consider a decade beginning with the year 0 or whatever, it's also the first one of the decade. I'm going to have Dr. Johnson, Vice Dean Johnson, introduce Karl, but let me just mention a couple of things. I've known Karl for a long time, and he's going to talk about an event that he did that's near and dear to his heart, and he's going to most likely talk about how collaboration took place, how a lot of people helped, but the bottom line is he did it. He's the one that did it. And so I think, you know, it needs to be noted, he's very, you know, he's willing to share the work among other people, but he was the driving force behind it. So I think that's really important to remember this. So with that in mind, Dr. Johnson, if you could introduce our speaker. So.
Well, welcome everybody, the Dean's Distinguished Lecture Series speaker. I'm very pleased to introduce our speaker for today, Karl Larson. Karl and Mark go back a long way, and Karl, for that, we're profoundly sorry. We won't hold it against you, though. He is the chair at Gustavus Adolphus College, a Lutheran-based college in southern Minnesota. I'm going to speak with Dr. Halprin and make a recommendation to the board that we change our name to New Yorkus Medicalis College. He is currently working with that college to create an undergraduate degree in public health. He's an accomplished teacher and writer. He's very much liked by his faculty. He loves teaching. He enjoys doing research, but truly loves working with students and giving them opportunities to learn by practice. What he will be known for is his idea, development, and implementation of a national case study competition. This first competition was held in early 2000 and has grown tremendously in size and in popularity. And as a result of that work, Karl received the Karen Denard Goldman Mentor Award by Sophie in 2018. So we're very pleased to have Karl, and unfortunately, I'm in the middle of selling a house and buying a house, so I'm going to have to leave before he's done today. So I'm going to do something now that should probably be done at the end and present him with a little memento of our appreciation. So Karl, thank you so much.
Thank you. Appreciate it.
By the way, Dean Ambler is in Las Vegas at the Tour of Deans meeting. Otherwise, he would be here today to that introduction. So.
Thank you very much. I appreciate the opportunity to be here, and thankful to Dr. Ambler and Dr. Kittleson for the invitation to come and speak here. And I'm gonna talk a little bit about the series. Thank you all for coming. And whoever has zoomed in, thank you for being here as well. A very little bit about me. I am a true blue Minnesotan. I hate talking about myself. That's always the hardest thing to do. And so in terms of background, I hadn't always planned to go into education. Like so many people in public health, this was a field of discovery for me. This is something that came after I had already been into a couple of different disciplines, quite frankly. I was actually going to be a recreation therapist, if you know what that is. There might be 2 people in the room who understand what that is. You know what that, really? Well, she's one of the 5 still working in the field. That's good. My first full-time job was $14,000 a year, full-time, no benefits. So much for rec therapy. That had to go. And what I did really get out of that experience was more knowledge about where I really wanted to be. I knew I wanted to work with people. I knew I wanted to be on a college campus. And so I was going to end up going back to school. But first, I got married. This is my crew about 3 or 4 years ago. And as the picture would imply, my wife is literally the only one who took this seriously. She was the only one even paying attention to the photographer at the time. The rest of us were goofing around. and all of my children are clones. It's really interesting, you know, they talk about how parents influence their children, right? We all preach that story. I'm a health educator. My wife is an MSW. My daughter now at 27 is working with severely autistic adults and children. And my son, who's next to me there, who looks like mini-me, same sweater and everything for the picture. That was really weird. He's working with the mentally ill in St. Paul. The young one, he's going to end up in Hollywood. He's the actor in the house. But because we've all gone into these service fields, we are a family that is wholly committed to living in middle income land. That is where we will end up. So I did go back to school. At that stage in my life, I was going to be a student affairs administrator. Interesting thing happened, however. This is Southeast Missouri State University. That was my first full-time job in student affairs. And the department chair for the therapeutic recreation program went on sabbatical. And somehow he learned that I had a degree in TR. And so he asked me if I'd be interested in teaching the Intro to Therapeutic Rec class for him while he was on sabbatical. I said, sure, I'll give that a shot. I'd never been in the classroom before. I'd never taught before. And I was hooked. I mean, I was absolutely all in once I had the opportunity to teach in a class, and I knew that was the direction I wanted to go. The Intro to TR class morphed into the Intro to Health class, and I taught that for 3 years. And as everybody in the room knows, if you want to do this full-time, real gig, you got to have the letters after your name. And so, again, I decided to go back to school. I went to Southern Illinois University, completed my Ph.D. there in community health education. The organization at the time for health educators, of course, was AFERD, which is the American Alliance for Health, Physical Education, Recreation, and Dance, and whatever other groups wanted to be a part of it. But that was an umbrella organization. All of these other groups underneath there were their own organizations. AHE was the one for health educators, the American Association for Health Education. And as a part of that, because of my interest in working with students and in mentoring, I ended up on the Student Involvement Committee. And I had an idea. You like my guy? He's got big feet. I like that. This really is a story just about an idea. And it wasn't a really well thought out idea in the beginning. It was a long shot. Most people either didn't understand it or didn't like the idea. But it's a story about how if you can get a few people who have some grit and some stubbornness and are willing to dig in and keep going, that good things can happen. And you can make that idea come to fruition. The Student Involvement Committee was responsible for planning activities for undergraduate students at the National Convention. This is what the room looked like most of the time when we organized events for undergraduate students. Okay, maybe not completely empty like this, but they were very few. And we really weren't getting undergraduate students. And it was frustrating for conference organizers and for those of us on the Student Involvement Committee and for the leadership, because we wanted more students involved. Then the idea came. And when I was working on my master's degree, I had actually participated in an event at a national conference that allowed me and a fellow student of mine to demonstrate our ability to apply theory and practice to solve a problem. So it gets to be 2004, and the convention's being held at the McCormick in Chicago. And it's here that I pitched the original idea to create an avenue for students to come to the national convention and showcase what they've learned in their academic programs. What's on the left is what I saw in the room while I was explaining this. What's on the right is what I heard in the room while I was explaining this. The committee had no idea where I was going or what I was talking about. They really were unsure about the idea. And just to kind of get me to move along, the chair said, you know what, Karl, go ahead. You can figure out a way to pull it off. Go for it. Like, okay, I like that idea. So I got 3 or 4 people to stick with me, to listen, to talk through it. And we had to figure out how we were going to organize this thing. We had to figure out how we could move forward, what role it was going to play at the convention. And it proved to take a lot longer than I thought it was going to take. It's now 2 years later. It's 2006. We're at the Salt Palace in Salt Lake City. And this is where we held the first case study competition. So it took us 2 years to get a structure put together. We had 5 teams nationally that committed to come to the conference in Salt Lake City and show us how they would develop a community approach to a public health problem. The first problem we used was influenza, right? That's very busy. I'm not going to read all that to you. But I put it up here because as the very first case, we thought we were doing a great job with this thing. And it really, as we look back 15 years later, look at this case now and go, ooh, how did we do that? How did we put that together? First of all, it's all fiction. Everything in the case was fiction. We called it Springfield because every state's got a Springfield, right? And so we wanted people to relate to that. And if you're a fan of The Simpsons, that's why they live in Springfield as well. We made up the population. We made up the fact that it was rural. We made up what the income was. This was all just off the top of our heads, and we talked it through on what would a rural Springfield look like. So we did that, gave it a few major employers in town, no mass transit, multiple ethnic backgrounds, and a significant proportion of Spanish-speaking individuals in the community. We tied the students to the local public health department, which we made up as well. And then the issue was that in December, they had an outbreak, right? Their reported number of cases in Springfield of influenza was much higher. Their vaccination rates for the flu were very low, and they had 2 deaths associated with it. So the students were supposed to develop a plan to address this. Now, some of the problems that we've noticed since then, my favorite problem that we had with this, students work in teams of 3 when they come to the conference. The last line in the agency says, "You are employed as the only health educator." We missed that one. That was one of the mistakes that we've made. But as I'll talk about, all of the cases have evolved since that point. So in general, how this works is I have a team of professionals that work with me every year to write a case. It's really been 3 of us for the last 12 of the 15 competitions that there have been. And we write the case. We sent out, initially we sent out a broad invitation to all of the schools we could identify through AHI that had community health programs and public health programs to see if they wanted to bring a team of students to the conference. Those teams of 3 then work together to design their intervention that they think would address the problem. They present their ideas to a panel of experts at the national convention, and then those judges evaluate the student proposal, and they do that based on a framework of criteria that we had put together for that first conference. What we learned early was we had to be careful of what we wished for, because once the Student Involvement Committee figured out just how much work this was, people didn't want anything to do with it. Folks do, if you've been a part of committees at the national level, you know that it's great work, but nobody wants their life to be consumed by it, right? That's kind of how that works out. At the time, I don't remember this exactly, Mark, maybe you do. We were all on 2-year or 3-year cycles on committees at the time.
3 years. Yeah.
Okay. So most everyone was transitioning off the committee at the end of that year, except for 3 of us. And no one who was transitioning off wanted to stay on the committee because they were just like, no way, we're not taking this on. But the 3 people who weren't said they'd stay on. I got elected the chair basically by default because no one else wanted to touch this. But I was fired up. I thought we had something that really could work. And I couldn't wait to get going on it. But the event, it had some mountains we had to jump over. And we had learned several things in this first attempt in Salt Lake City. The structure was a problem in our initial. What we did was when the student teams arrived at the conference, that's when they get the case. So we would meet the first evening, we'd give them the case, and they'd have 48 hours to come up with their plan and then present it to the panel of judges. The fallout from that was that our primary goal couldn't be reached, which was to get undergraduate students involved in the convention. Why? Because for 48 hours, they never came out of their rooms. All they did was work on the case. And so while it was good for the case study, it was bad for the overall goal, which was getting students involved in the conference experience. Judges was a problem. Part of the problem was we couldn't really explain to people yet what we were doing and what we were trying to accomplish. It was new for all of us. And so we would ask people to judge and they'd be like, well, what does that really mean? And we would describe it differently, essentially, to everybody who we were trying to get on board. It's like we needed people to commit to a half a day for free, or as we call it in academia, service. And we really didn't have anything to give them at that point. We also had a significant criticism of the first year because we couldn't get a space for a day at the conference. We couldn't get a single space for a day. So we had to split up the teams, do it in 2 rooms with 2 different sets of judges. Where are my researchers? What's the problem with 2 sets of judges in 2 different rooms? We had every opportunity to see that group 1 may not have been evaluating the same way group 2 was evaluating. And we got called on it, and rightly so. It was not the way we wanted to move it forward. So we had to come up with a way to essentially figure out the judging component of it as well.
And the conference typically would go like Wednesday through Friday. And so you gave this on Wednesday and
they would present on Friday. Right.
Which was another problem with judges because they were involved with the conference.
Correct. And they had presentations of their own to do, and they were speakers and they were moderators. They were doing all their own things. We had one final hurdle we had to get over, and that was the idea of a competition. We called it the National Case Study Competition. And honestly, I still don't know that we fixed this problem after 15 years. It is really supposed to be developmental. I mean, here's an issue. Show me what you've learned, right? And here's the opportunity to apply all of this stuff. As soon as we called it a competition, it became one. And the students are competitive, right? And especially your high achieving students tend to be very competitive. And that's who departments picked to come and participate, was their better students. So we had this thing going where they were taking it very, very seriously. So were the advisors, because what some of the advisors saw is a reflection on their program. If we win, that's good. That shows that our students are leaving and they know what they're doing. And I don't know that we've entirely fixed that problem. I mean, we've gotten to the point where I talk to every single team before they present every single year. And that's all I do is reinforce this idea, is that just by getting here and having done this, you've shown us something. But it's still really disappointing if teams don't, win the competition. And that's something that we still wrestle with, I think, as a part of a competition. So the AHI years, how this evolved, kind of give you the idea of where we started. We went to a single room format in 2007. So we went back to the AHI folks and said, this has got to be in one room. You got to give us a space for a long enough time to pull this off. We only had 6 teams, right? We would let 6 teams come. First 6 that said they wanted to be in it, and that was fine. So they get about 30 minutes, 20 minutes to present, 10 minutes for Q&A. And so we needed a room for a full day so everyone could present and we could deliberate. Judges stayed in the room all day, watched all 6 squads, and then had conversation at the end. So we did go to a single room format. We went to fully referenced cases in 2008. which means the issue and the agency became real things. We didn't make them up anymore. We did that the first 2 years. We didn't feel like we could continue that model. And frankly, it's a way better model to put real stuff on the table for students. And so that's what we moved to. We also went to a 2-week prior delivery time. So to this day, students get the case at their school 2 weeks prior to the convention. And then they get 2 weeks to come up with their plan. And then they come to the conference. It happens on the first day prior to sessions starting, and then students are free to go to the rest of the conference. So we changed that structure very early in order to reach that goal of getting students more connected to the convention experience. In 2009, we went to using the NCHEC competencies for our judging evaluation. So we took the 7 competencies for undergraduate education and created judging criteria, a rubric basically, based on those for the judges to use as a reflection of students' ability to demonstrate that they've met those competencies. So that came into play in 2009. In 2011, that was the first year we went to local issue development. So now what happens is, like, we're going to be in Atlanta in March. I researched Atlanta. I looked at what are your major health issues in the Atlanta area, and we're going to pick one. So the students now are in that rhythm of, okay, we're going to Baltimore. Let's see what's going on in Baltimore. And it's funny because we have, I'll talk about this more later, we have schools that have gone to the case model for some of their classes, and they'll take where the conference is going to be and have their students start thinking about it in a fall programming class prior to getting a case that they're going to work on for the competition in the spring. It's a really interesting dynamic that's come from this. We also started to integrate local judges. For the most part, it had been college faculty and people like Dr. Kittleson who were on board with the event. They would agree to be a judge. Now we've got people from the local public health department who are dealing with these local issues who are sitting on a judging panel. And so they're evaluating the students' approaches to dealing with their local problems as well. And then we had what I like to refer to, you remember this year, right? The Great Boston Technology Adaptation of 2012. Great formal name. If you were at AFERD in 2012, do you remember what happened? Was anyone there? No one was there. They had a transformer blow up in the center of town and Boston went dark. And they thought, oh, it's going to be 3 or 4 hours. We'll have everything back up on board. No. Then they thought they'd have it up the next morning, then the next day, then the second day. It was 2.5 days of dark in Boston. There was no way to hold the competition. Now, one of our rules for this competition is you can't use technology. Students have to get up in front of you and talk about what their ideas are and how they're going to address the problem. And so, because the background for that is really pretty simple. We didn't want tech savvy people to wow the judges with their stuff instead of with their ideas. So we got rid of technology. 15 years into this, everybody's kind of on an even playing field now. So I think we're more likely to move something that shifts that. But at the time, there's no technology. So we had students go home, because that's the only thing we could do, was send them home and create a YouTube video of their presentation. They sent them all to me. I farmed them out to the judges. The judges reviewed them, sent back all of their feedback. I calculated everything, and we determined our winner that way.
The whole conference was canceled.
The whole conference was canceled. Nothing happened that week. Well, we got 4 days in dark Boston. That was fun, but that was about it. We just happened to be in that 10, 12 block radius area that went dark.
And yet our hotel, we have power.
Yep. So those were the early years. But in 2013, if you recall, AHI folded. AFERD restructured. And as a result, AHI folded. And AFERD became Shape America. And was predominantly physical educators, which I think it still is. There are some health educators who are still part of that, but many of us morphed. And the incoming Sophie president at the time had asked me if I'd be interested in moving the event from the former AHI to Sophie. I said, sure, not really knowing Sophie very well. I hadn't been connected to it. I think I'd only been to it once in my professional career. She went back, pitched it to the board of trustees. They loved the idea, and we were on. And so we didn't miss a year. We were able to get things up and running right away with Sophie and hold the event at the national convention for Sophie the next spring. The Sophie era has been really, really good for the competition. Like I said, we had 6 schools participating each year, and that stayed in place for the first 8 competitions. We had no more than 6. In 2015, we expanded to 8. In 2016, we expanded to 10. Now, think of the structure. We've got 3 judges in one room with 10 teams presenting, and they're just watching team after team after team after team. We're hitting a tipping point with the number of teams judges can actually listen to and not have it turn into mush in their heads. We had our first external sponsor in 2016. Mark, do you remember who it was? It was Heater Publishing. That's it. And then in 2017, 2 big things happened. We expanded again to 12 undergraduate teams, but we went back to a 2-room model. And how we did this and justified it was we put 6 teams in one room with a set of judges and 6 teams in a second room with a set of judges. And at the end of their presentations, we took the top 3 from each room, had them present again in the afternoon to all of the judges sitting in the room at the same time. What that did essentially was triple the amount of time that the judges were committed to. And the judging is a continuous issue with this event. It's not like we've had bad judges. We've had fantastic judges who are committed to this and give their time. I have 2 judges who've done every competition. And so, but we had to do that in order to expand the undergrad program. The other great thing that happened in 17 was that we added graduate school students to it. And we now have a grad school level competition. That has taken the original model because we can't jump into the big model with the grad school. So we just have 6 teams. We just use 1 room and 1 set of judges. We have the top 3 teams out of the undergraduate program, which get awards at the end, and the top 2 out of the graduate competition. Not really any changes in 18. In 19, we had to go to what I refer to as pay to play. It's probably not the best way to phrase it, but we had a problem. Student teams, advisors were signing up student teams in the fall, and then they weren't showing up in the spring. And so we'd have a competition for 12 and 9 would show, or a competition for 6 and 4 would show. That's a problem, right? Because you're killing a spot that another team wants to be in. So we added a fee for the competition. We're trying to figure out that last year was the first year we did it. So we don't really have a sense of whether that's going to be prohibitive. It wasn't last year. The students, what I'm taking from at least year 1, students aren't having to pay for this. Their colleges are paying, it's $100. It's not a lot of money. So their departments are finding $100 to throw at the competition so that they can bring a team. We also had our second major sponsor, the Foundation for the Advancement of Health Ed, is a sponsor. I think it's a couple of year commitment that they've done. And I understand that we have another sponsor that's going to be on board for this year. And I don't know if that's public yet, so I'm not going to go into a lot of detail. But what this tells me really is that we've got a lot of support. This has become an ingrained component of the national convention. Oh, excuse me. Oh my goodness. I'm so sorry. Man, drink. Students look forward to this every year. We have a lot of repeat schools, but we have a significant number of new schools that participate every year, and that's really a great thing. So that kind of brings you up to date on where the competition is now. So I'm going to talk just 5 minutes more maybe, and then open it up for questions. Outcomes. These are not scientific. We have not done the research to nail down specific outcomes, but this is what we've observed over 15 years. This has become one of the most visible platforms for demonstration of the competencies in the discipline. And we think that's great. Really think that's an awesome way for students to show that they can step into a public health environment and do this job. That's really the big win out of this. It's also an opportunity for school faculty to see their students put this stuff into play. I mean, it is, I wouldn't say it's a reflection on the quality of their programs, but it is absolutely a moment of pride to see that your students have learned enough to go and do this whole thing. And so that's a neat outcome. We've had over 300 students and over 30 different colleges and universities participate over the 15 years that we've done this. To me, that's a lot of fun. We have a realistic and valuable experience that ties students to professionals at the national convention, which was the primary goal. I see conversations happening all the time between students who participate in this competition, and they're just talking to faculty who are involved in doing the job on a regular basis after the competition is over. They'll be just engaging and crossing paths at social functions or in sessions, and they'll go, oh yeah, I'm here for the case study competition. And the professionals know what that is, and the conversation is on. So that's a really neat opportunity. I think that's grown quite a bit out of this. SOFI benefits. If you were, there's more student involvement, which is what we all wanted. There is an established reason for, continued reason for people to come to the conference. And if you were to take all of the conference registration fees and put them together, and the event registration fees and put them together, and the sponsorship dollars and put them together, it's roughly 20 grand a year that's associated with the program. Now, I can't sit here today and tell you that this program brings in $20,000 a year. That's not where I'm going with that, but it is certainly something that benefits SOFI for their conference fees and dollars that they need to do. So it's good for the organization as well as good for the students. As I stated earlier, there's several health ed programs from around the country that are using this case study model in teaching their program planning classes. And not just program planning, but their senior seminars and their capstone experiences. So it's getting to more students than just those who come to the competition. We had our first alumni of the competition come back to be a judge a couple of years ago. That was really fun. It was great for me to see that happen, and we're going to try and do more of that as we go forward. And we've had at least 24 professionals who have either been judges or case writers over the last 15 years, and so that's a nice service opportunity for them to be a part of the competition. And then finally, where are we going? What do I see in the future? If I had a crystal ball, it'd be fun to see where this thing is going to be in the next 10 years. What would I really like to do? I'd like to find a way to go back and identify the alumni who participated in the program, just to see if this was valuable, right? Wouldn't that be nice to know that actually doing this meant something for their professional careers and something for their, if nothing else, just to build some confidence in what they were going to do when they got out of here. I don't have a vehicle for that yet. If you're a great, qualitative researcher, call me. Let's figure this out. We'll get this one done. I'd like to, at some point, develop a book of the cases that would be available to schools of public health, community health education programs, folks that are training professional health educators, so we could expand this idea of using a case model in professional preparation. Been a lot of talk about regional competitions, feeding the national competition. And so SOFI has smaller state and region organizations all over the country. We've had a couple that are now doing their own case study competitions in their state, which I think is awesome. But we've talked about, is there a way to build 8 regions and then have them come to national after doing that? that may be something that we get to over time. I do want to expand the graduate program. We have way more graduate teams that want to be in this than I have room and the capacity to work with right now. And then
master's or doctorate or both for the graduate?
it's usually master's level students, but we get doctoral students, yeah. It can be either one. And then maybe a greater degree of NCHEC involvement, because the judging criteria are really based on the competencies that they manage. We haven't had, I don't want this to come off the wrong, we don't have a bad relationship with NCHEC, just the bridge has never been built between the competition and the agency. And I think that's something that can happen, should happen, especially now with the revamping of the competencies and with the latest project that just got done. That really is the history and how this thing came together and has grown over time. As Mark said, there's a big chunk of my professional career that's wrapped up in this thing. So I could talk about it all day long. It's fun to do. But that's where I'm going to wrap up. I'm happy to take questions about anything that you might want to know more about. Thank you so much for the opportunity to talk.
Most people online, if you have a question, you can unmute yourself, ask the question that we asked you, and make yourself back up. So,
yeah, hi, this is Kelly. This is a question for Seth.
NCHEC is the National Council for Health Education. So they established the CHES exam and the MCHES exam, and that's how educators get certified in this.
I'm sorry, who's speaking? Can you say your question again? Yes. Okay. Questions?
Maybe she could just, he or she could type in.
Maybe.
They may have done it in the chat. I heard keyboard. Check to see on the chat.
Yeah, let me do that while you're.
Oh, yeah,
Anyway,
you
go
can
ahead.
turn this off.
Go ahead.
Yeah,
Questions?
if anyone has questions, I'm happy to answer. Yes.
When you introduced the grad program,
Mm-hmm.
how did you make the case study different, and how was it different than that?
It's not.
Was that
It's not different. No.
the criteria?
The judging criteria, the theoretical application is expected to be more detailed at the graduate level. There are years that we direct students as to what theory to use, and there are years that we don't. And so in the years that we direct them on how to, on which theory to use to build their program around, we expect greater degree of that from the graduate students, but the case itself is identical. We don't make any changes to the case.
Okay. No, I'm just seeing if anyone is asking a question. If you're online, if you want to type a question, we'll try to answer them as well. So, go. Any other questions?
Yes.
So it's been going on 15 years?
2006 was the first one, so would that make this our 15th? Yeah.
And so how many, each year you have one winner?
The undergraduate program has a first, second, and third, and the graduate program has a first and second.
And do you find that the same schools typically do well?
Not as much now as in the early years. We had one school that won the first three of them, and it was, you know, they were the little dynasty, right? We started teasing their advisor about having the dynasty in the case study competition.
The Super Bowl early on with Northern Iowa.
Yeah, University of Northern Iowa. Yeah, and Tom Davis was their advisor, and Tom is a dear friend and an old colleague, and well, I guess he's not in. Well, I don't know. How do you phrase that? You've known him a long time, and he brought a team every year for I think the first 13 years. So there are schools that are regular participants and have placed more. Some of that comes from just having the experience of having done it. Interestingly enough, we don't get a lot of return students. So we don't like get a set of juniors one year and then they come back as seniors the next year. Sometimes there's one that will be in 2 years in a row, but it's really not as common as I had anticipated it would be. The graduate program's too new to really have history behind it. But Northern Iowa, Eastern Illinois had a team every single year. We've done this for 15 years. They bring a team every year. The Utah schools bring teams all the time. And that includes BYU, Idaho. They bring teams every year. And I don't want to get into naming specific schools because I know I'll forget somebody and that's terrible. But there are schools that we do see bring a team regularly. But like I said, of the 12 in the undergraduate program, we'll have 3 or 4 or 5 that have never done it before each year. And that's exciting. That's really what we want as much as we can. Yes?
I think this is a really wonderful project, and I'm also a certified chess, so I heard about your work. So I'm wondering that for those who got actually awards, did they result in any competitions? And I think that it's really meaningful to see what's happened to those like students who actually won an award, and then what's happened to them. Did anybody that's in contact with you or?
As the old saying goes, hindsight is 20/20, right? I don't have records of the early years on which schools participated other than the ones that placed in the top 3. And I'm kicking myself for that. I have them from 2011 on, but for the first 5 years, I really don't have a list of all of the schools. So like I said, trying to find a way to go back and find alumni other than doing something like a mass hit on the heater that says, hey, if you ever did this, we got a survey that we created. I'd love to hear from you. I don't know how many we'd find or how many would do it. The competitive part, there was a part of your question about that. I missed that though. What was it again?
Actually, I was curious about how this was able to build in the class format. You said that there are some class that actually was built based on that model.
Yeah.
So what do you mean by that? Can you elaborate?
One of the schools that I'm aware of, they have interwoven their program planning and evaluation courses together, so it's a full year. And so they'll get through the first semester, and then the second half is doing the case. And so they'll have them working on that the entire term. Others will use it as a means, they'll what I call chunk it. They'll find the part of the case that applies to the piece of program planning that they're talking about and have students use that as a basis for conversation. And then by the end of the semester, they've talked about all of those pieces of the case before they get to the end. And I know of a couple other schools that use them to practice, quite frankly. It's like, well, we've got the ones from 2015 and 2016. Why don't we do a test run in the fall? And then when you get the case in the spring, you'll have done it once before you go out there and do it again. So there are other ways that happens. The advisors, one of the other rules in the competition is that the students must work independently. No other students can help them on the case, and the advisors can't help them on the case. That really ties the advisor's hands intentionally, right? There's only so much the advisors can do without violating that rule to be a part of the conversation. And we did that on purpose because I don't want students to take the case and then do what a lot of our A-level students do because they get A's. They go, well, would you review this part for me? Or would you review this part for me? And do that throughout their entire development of the plan. We don't want that happening. And so once the advisor hands the case over, they're out of it. They can't talk to the students anymore about it. Now the students could say, where do we find data related to blah, 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 blah. And I'm sure the advisors can do that. But in terms of giving them materials or handing them resources or telling them about an agency that's dealt with that problem, they're not supposed to be doing any of that.
And advisors aren't allowed, is it still in to watch the presentation?
No one's in the room but the students.
And the judges.
The judges. Yes, Mark, and the judges. Now we've had some advisors historically who were more adamant about being in the room. Okay, I'm not going to get into a big battle over that. essentially what I tell advisors is, I want you to make sure your students are okay with it. I'm not the one you need to ask. Because if you're a student in this room right now, and you were doing this competition, if your advisor, if your faculty member was in the room with you, that would ramp up my level of anxiety, knowing that they were watching what I was doing. And so that's one of the reasons to not have the advisors in the room, is because the students are much more comfortable sharing their ideas without having the hovering of the advisor watching over everything they say. Well, there is one other future thing that I guess I would say before I forget about it. We've talked about this several times and we just haven't been able to pull it off, which is to record each of the presentations and then post the winning ones so that people can see the great work that these students are doing. We just haven't been able to figure out, because then we got to get release forms signed for videotaping, and then they have to agree to have the video put up, and then we have to have space for it. And someone at Sophie, who manages their website, has to manage all of that stuff. And we haven't gotten through all of those hurdles yet, but I think we're moving in that direction.
Follow up real quickly. The 1 year that I was speaking to, I think it was Coastal Carolina or whatever, somebody that won. They were talking to me the next year that I said, well, how was it last year when you went back to campus? And they made a huge deal about it. The president of the college, the provost, the dean all came into the class with the students, say, hey, graduate. I mean, it made news in that whole community. So a lot of these colleges, they take this very seriously.
Yeah.
I guarantee you that in the future, when they want money to go to this conference, the president and the provost will find ways to fund this, because it's they really see a value to it.
I've seen a number of newspaper clippings from campus papers and from departmental and divisional newsletters that's got photos of their teams in there, even if they're not placing in the top 3, just to show that they were competitive at the national level to do this. They really fly that flag for their students.
Do all the teams get a certificate?
Yes, everybody gets something that says they were there, and then the top 3 get a particular one that's framed and all of that. Anything else that I can answer for you?
Let me see if there's any other messages online. Again, if you're online, folks.
Did it show up there if there was?
I think so, but I don't know if it's here or if it's. Well, we lost. Oh no, we have 7 people. I would think it'd show up in the chat right here. So.
I don't think anybody.
Okay.
I was there.
No, not yet.
Okay. So, any other questions? Thanks for showing up. We've got refreshments.
Thank you all so much.
Stick
I
around.
appreciate
So
you.
thanks for
Thank you.
Hey, thank you for those online. We're going to record this and we're going to save it. We'll let you know the link. So